Good afternoon, dear judges and members of the House. Today I'll be presenting a study on the ocular surface microbiome in patients with breast cancer. We know that the ocular surface microbiome is paucibacterial and helps in maintaining the ocular surface homeostasis, and any derangement or dysbiosis leads to ocular surface disease. The study came about with the concept of that breast cancer therapies like chemotherapy and radiotherapy and hormone therapy do cause some amount of ocular surface symptoms and dry eye disease. So with the rationale of finding out the connection between ocular surface disease, meibomian gland dysfunction, and the core ocular microbiome in these patients, we planned this study with the primary aim to characterize the ocular surface microbiome by metagenomics in these patients who were on systemic therapy, and the secondary aim was to find the ocular surface parameters like ocular surface disease index, the non-invasive breakup time, LLT, and tear meniscus height through the ocular surface analyzer. So breast cancer patients undergoing various systemic therapies were recruited from the surgery department at All India Institute of Medical Sciences, New Delhi. So conjunctival swabs were taken from the inferior conjunctival fornix, and DNA was isolated, and then a microbiome analysis was done by bioinformatics. The patients also underwent a comprehensive ophthalmic workup, including a dry eye workup. Coming on to the results, the age range of the patients was from 30 to 79 years, and most of them were under either hormone therapy or chemotherapy, and there was an equal distribution in these groups. On dry eye workup, we saw that it was surprising to note that all the patients had some form of meibomian gland dysfunction and had a deranged non-invasive breakup time. The lipid layer thickness was thin in all of these patients to a varying degree, and these were some objective evidence we got, and then all patients had a thin lipid layer and a reduced non-invasive breakup time. When we did a microbial analysis, the diversity analysis showed that patients on chemotherapy had a less diverse microbiome than a normal core microbiome, and they also had a decreased richness. So this is the genera that was found in the three groups. NT is the treatment naive or no treatment group, HT is the hormone therapy, and CT is the chemotherapy group. We can see in the chemotherapy group we have an abundance of staph epidermidis, which likens to a core microbiome in patients with dry eye disease and meibomian gland dysfunction. However, the treatment naive did not have much prevalence of staph epidermidis. They had a virome which is near the core microbiome or a normal ocular surface microbiome. Even Klebsiella was found more in patients on chemotherapy. So to conclude, the ocular surface microbiome profiles in patients of breast cancer did show a core microbial community as that of patients with dry eye disease and meibomian gland dysfunction. It is a less diverse microbiome with increase in flora like staph epidermidis, and we see that all therapies for breast cancer impair the ocular surface. So the findings of this novel study suggest that there is a microbial shift, and there may be a role of microbiome targeted therapies to decrease the prevalence of dry eye and ocular surface side effects due to breast carcinoma therapies. Though this was a cross-sectional study, we recommend longitudinal cohorts pre and post-treatment sampling to determine causality and explore microbiome targeted therapies further. Thank you.
Any long-term studies going on?
Yes, sir.
Your studies?
So the samples are collected. This took 2.5 years.
And how soon we start seeing the symptoms of dry eye in these chemotherapy or whatever?
So around 6 months. So the range of the duration of the disease was from 6 months to 10 years in these patients. As early as 6 months, they had symptoms of dry eye disease, and also all of them had signs.
So you suggest after 6 months one should have
they should be referred to an
ocular
ophthalmologist, and proper therapy should be started.